Have you ever gone to bed thinking, I did not even eat anything sweet tonight, but then the next morning your blood sugar is still higher than expected? That can feel confusing. And honestly, it can feel unfair. You skipped dessert, you tried to eat better, maybe you even had a light dinner, but the number still looks stubborn in the morning. So when people see a video saying, this one drink flushes 95% of sugar overnight, it gets attention fast. But let's be honest, your body does not flush sugar like a sink draining water. And no drink can erase diabetes, insulin resistance, or years of blood sugar problems while you sleep. But there is one simple drink that has been studied for blood sugar support, especially around meals and bedtime. It is not magic, it is not a cure, and it is not for everyone. But when used carefully, it may help some people support better morning glucose. That drink is diluted apple cider vinegar water. Not straight vinegar, not a giant amount, not a dangerous challenge from the internet. Just a small amount of apple cider vinegar mixed into a large glass of water. And before you try it, please listen carefully, because the safety part matters more than the drink itself. If you take diabetes medicine, insulin, blood pressure medication, water pills, or if you have kidney disease, acid reflux, stomach ulcers, gastroparesis, or low potassium, talk with your doctor first. Apple cider vinegar can affect digestion and may lower blood sugar in some people, which matters if you are already on medication. Now let's explain why morning sugar can be high in the first place. Most people think, if I did not eat sugar at night, my blood sugar should be low in the morning. But your body is more complicated than that. During the early morning hours, your body starts preparing you to wake up. Hormones like cortisol and growth hormone can signal the liver to release glucose into the blood. This is often called the dawn phenomenon. In a healthy metabolism, insulin helps keep that glucose under control. But if you have insulin resistance, prediabetes, or type 2 diabetes, your body may not handle that early morning glucose as smoothly. So the problem is not always what you ate right before bed. Sometimes the problem is what your liver is releasing overnight, how insulin sensitive your body is, how late your dinner was, how much carbohydrate was in that dinner, how well you slept, and whether your medication timing is right. Most people miss this part. They blame one snack, one fruit, or one slice of bread. But morning sugar is usually a pattern, not a single mistake. This is where apple cider vinegar becomes interesting. Apple cider vinegar contains acetic acid. Research suggests vinegar may help reduce blood sugar rise after meals by slowing stomach emptying and affecting how carbohydrates are broken down and absorbed. Some studies also suggest it may modestly improve fasting glucose in people with type 2 diabetes. But remember the word modestly, not 95%, not overnight transformation, not drink this and eat anything. Think of it more like a small helper, not the main driver. The main drivers are still your dinner, your movement, your sleep, your muscle, your medication plan, and your overall insulin sensitivity. Here is the simple version. If dinner is high in bread, rice, pasta, potatoes, dessert, or late-night snacks, your body may still be dealing with that glucose while you sleep. If your dinner is lower in protein, low in fiber, and high in refined carbs, the glucose rise can last longer. If you sit all evening after dinner, your muscles do not get much chance to use that glucose. And if sleep is poor, stress hormones can rise, and that can make morning glucose harder to control. So the drink may help most when it is used with a smarter evening routine. Here is the safer way many people use it. Take 1 teaspoon to 1 tablespoon of apple cider vinegar and mix it into a large glass of water. About 12 to 16 ounces is a good amount. Drink it with dinner or after dinner, not as a straight shot. Never drink apple cider vinegar undiluted. It is acidic and can irritate your throat, stomach, and teeth. You can use a straw if your teeth are sensitive. Rinse your mouth with plain water afterward. And do not brush your teeth immediately after acidic drinks because enamel may be more vulnerable right then. Now, should you take it right before bed? For many people, taking it with dinner or shortly after dinner may be gentler than drinking it on an empty stomach right before lying down. If you have reflux, heartburn, stomach burning, or nausea, this may not be a good fit for you. A simple drink should never make your body feel worse. Now let's make this practical. Imagine 2 different nights. Night 1, you eat a big late dinner, maybe bread, rice, dessert, and then sit on the couch until bedtime. Then you drink vinegar water and expect it to fix everything. That is not how this works. The vinegar is not a sponge that soaks up sugar. Now, night 2, you eat dinner a little earlier. You build your plate around protein, non-starchy vegetables, healthy fats, and a smaller portion of carbs if you choose to have them. Then you take a gentle 10-minute walk after dinner. Later, you have your diluted apple cider vinegar water if your doctor says it is safe for you. That second routine gives your body much more support. The walk matters because your muscles act like a glucose storage tank. When you move after eating, even lightly, your muscles can use some of the glucose from the meal. You do not need a hard workout. You do not need to punish yourself. A simple walk around the house, hallway, yard, or living room can help. Your walking shoes may be staring at you like, are we doing this today or not? But just 10 minutes is a good start. And if walking is difficult, seated marching, gentle leg lifts, or light movement after dinner may still be better than staying completely still. Here is the part many people over 50 need to hear. If your morning blood sugar is high, it does not mean you failed. It does not mean your body is broken. It means your body is giving you information. And once you understand the pattern, you can start making small changes that actually make sense. One of the best things you can do is check your own pattern. If you monitor blood sugar, look at 3 numbers for a few days. First, check before dinner. Second, check before bed. Third, check in the morning. If your number is already high before bed, dinner may be part of the issue. If your number looks okay at bedtime but rises by morning, the dawn phenomenon, medication timing, sleep, stress, or liver glucose release may be involved. If your blood sugar drops too low overnight and then rebounds high in the morning, that is a different situation and needs medical guidance. This is why guessing can be dangerous. A person on insulin or diabetes medication should not randomly add vinegar, skip meals, fast longer, or reduce carbs aggressively without guidance. Blood sugar can go too low, and that can be serious. So let's keep this safe and smart. The bedtime drink is not the whole plan. It is just one possible tool. Here is the better evening blood sugar routine. Step 1. Keep dinner simple. Build your meal around protein first. Eggs, fish, chicken, turkey, beef, Greek yogurt, tofu, or cottage cheese can all help depending on what you eat. Then add non-starchy vegetables. Think spinach, cucumber, broccoli, zucchini, cabbage, cauliflower, green beans, or salad. Then add healthy fats in a reasonable amount, like olive oil, avocado, nuts, seeds, or butter if it fits your diet. Then decide if you want carbs. For many people with high morning sugar, the amount and timing of evening carbs matter. Some people do better with fewer carbs at dinner. Others do better when carbs are paired with protein, fiber, and movement. There is no single rule for everyone. Step 2. Avoid the late night little bite. This is where many people get caught. It is not always a huge dessert. Sometimes it is crackers, biscuits, cereal, toast, fruit juice, sweet tea, or just one small thing while watching TV. That small snack can keep insulin and glucose active later into the night. And once the couch wins, the kitchen somehow gets louder. You know that moment. The bread starts calling your name like an old friend. But if morning sugar is a concern, the late night snack is one of the first places to look. Step 3, walk after dinner. Again, this does not need to be intense. A slow 10-minute walk may support glucose use. The goal is not weight loss in 10 minutes. The goal is to tell your muscles, please help handle this meal. Step 4, prepare the drink safely. 1 teaspoon to 1 tablespoon apple cider vinegar in a large glass of water. Drink it with dinner or after dinner. Do not drink it straight. Do not overdo it. More is not better. And if it causes burning, reflux, nausea, tooth sensitivity, or stomach discomfort, stop and talk with a healthcare professional. Step 5, protect your sleep. Poor sleep can make cravings stronger, raise stress hormones, and make insulin resistance worse the next day. Try turning off bright screens earlier, keeping the room cool, and avoiding heavy late meals. Even your best drink cannot outwork poor sleep every night. Now let's answer the big question. Will apple cider vinegar lower your blood sugar tomorrow morning? Maybe a little for some people, maybe not at all for others. The research is interesting, but your body is still your best feedback. If you monitor glucose, test carefully. Do not rely on how you feel alone. Try the routine for a few nights only if it is safe for you, and compare your morning readings. But do not change medication on your own. Do not use this as a replacement for medical care. And do not believe anyone who says one drink flushes almost all sugar overnight. That kind of claim sounds exciting, but it can mislead people who need real support. Here is a better way to think about it. Apple cider vinegar water may help slow the rise. A lower carb dinner may reduce the load. A short walk may help muscles use glucose. Better sleep may calm stress hormones. And the right medication plan may protect your health when lifestyle alone is not enough. When these work together, morning numbers may start making more sense. And even if the change is small at first, small changes matter. You are not trying to win a contest overnight. You are trying to build a body that handles glucose better day by day. That is especially important after 50, 60, and beyond, because muscle mass, sleep quality, hormones, activity level, and insulin sensitivity can all change with age. But change is still possible. Your body can still respond. You do not need a perfect plan. You need a plan you can repeat. So tonight, instead of chasing a miracle drink, try building a smarter evening. Eat a simple dinner. Avoid late-night snacks. Move for 10 minutes. Sleep better. And if it is safe for you, consider diluted apple cider vinegar water as a small helper. Before we finish, here are the people who should be extra careful. If you take insulin, sulfonylureas, or other diabetes medications, ask your doctor first because blood sugar may go too low. If you take diuretics, digoxin, or have low potassium, ask your doctor. If you have kidney disease, reflux, ulcers, gastroparesis, swallowing problems, or dental enamel problems, this drink may not be right for you. And if your morning sugar is consistently high, do not try to solve it alone with home remedies. Talk with your healthcare provider. You may need a medication adjustment, a different meal strategy, or overnight glucose monitoring. The goal is not fear. The goal is clarity. High morning sugar is not always your fault, but it is a signal worth listening to. If this helped you understand what may be happening overnight, like the video and subscribe for simple, science-based blood sugar and keto tips for later life. And tell me in the comments, is your blood sugar usually higher in the morning or after dinner? Your pattern matters. In the next video, I'll show you a simple 7-day low-carb dinner plan that may help support better morning blood sugar without complicated recipes. Watch that next, because the drink may help a little, but dinner is where the overnight pattern often begins.